Good day. Welcome to another day of virtual learning experience with my first step. At the end of this video, you will be able to identify the different parts and functions of the male and female reproductive system and identify and discuss changes that occur during puberty. The male reproductive system. Parts and functions. The parts of the male reproductive system includes the following: seminal vesicle, prostate gland, scrotum, testis, glans or the glans penis, epididymis, urethra, penis, Cowper's gland, and sperm duct or vas deferens. Penis. Penis is the external male organ with a tip called glans. It is covered with foreskin that may be removed through circumcision. Scrotum. Scrotum is a pair of pouch-like sacs. It serves as skin covering of the testes. It also controls its temperature because the testes might be slightly cooler than the body to produce sperm cells. Testes. Testes, singular, testis, are the glands that produce sperm cells and male sex hormones called testosterone. Sperm cells. Sperm cells are needed to fertilize an egg cell. Out of these millions of sperm cells, only one is needed to fertilize an egg. Epididymis. Epididymis is a narrow coiled tube that stores immature sperm cells. Vas deferens. Vas deferens is a long muscular tube that serves as a passageway of the sperm cells released from the testes to the seminal vesicle and urethra. Urethra. Urethra in males is the passageways of both urine from the urinary bladder and semen from the glands. Seminal vesicles. Seminal vesicles are sac-like pouches attached to the vas deferens. It produces a sugary-rich fluid that provides energy to the sperm cells' motility. Cowper's gland, also called as the bulbourethral gland, is one of the pea-sized organs found beneath the prostate gland. It is responsible in releasing fluid that flushes out foreign matter and neutralizes the acidic urine in the urethra. Prostate gland. Prostate gland is a walnut-sized gland located between the bladder and the penis. It secretes fluid that protects and nourishes the sperm. The female reproductive system, parts and functions. Let's start with the fallopian tube or the oviduct. It is also called the fallopian tube. Lies close to the ovary, waiting for the egg to enter. A tube that leads the egg from the ovary to the uterus. Usual place where the egg is fertilized by the sperm cell. Uterus. Uterus or womb, also called the womb, shaped like an upside-down pear, where the unborn baby is developed, has soft, smooth inner lining of the uterus called uterine lining or the endometrium. Ovary. Ovary produces egg cells and the sex hormones estrogen and progesterone. Females have two ovaries. Matured egg cells are released from the ovaries during menstruation, and the release of these egg cells or egg cell is known as ovulation. Cervix. Cervix is a narrow opening between the uterus and vagina. enlarges to let the passage of a fetus during birth. Birth canal. Birth canal, also called the vagina. Hollow muscular tube that leads to the opening called vulva. Expands to let baby pass through during normal delivery. Females are born with all the eggs they will ever have in their lifetime. When females reach puberty, they ovulate or release egg from the ovary every month. But these eggs are not created new monthly. They are actually born with all the eggs they'll ever have. With time, the number of eggs in the ovaries decreases. An egg cell. An egg cell is the largest cell in the human body, large enough that we can see it through our naked eye. Changes during puberty. Puberty is the stage of human growth and development in which person becomes physically mature. During puberty, young boys and girls like you experience changes in their bodies. Puberty happens between 10 to 16 years old. These changes, called secondary sexual characteristics, are brought about by the sex hormones from the ovaries and testes. In boys, the sex hormone is the testosterone. In girls, the sex hormones are estrogen and progesterone. Young boys experience an increase in the production of testosterone at the age of 12 to 14. The effects of testosterone. The effects of testosterone in the skin, hair growth, and collagen growth. Effects of testosterone on muscles. Muscle growth, increased strength, increased endurance. On bones, bone mass density maintenance. In the brain, increased sex drive, improved mood, confidence, and memory function. In the bone marrow, red blood cell production. Sex organs, sperm production, erectile function, prostate growth. The effects of estrogen in the heart, protects from cholesterol. Liver, cholesterol production regulation. Bones, bone strength, density increasing. Skin, anti-aging effect. Brain, body temperature adjustment, memory function, and libido adjustment. In the breast, breast growth, feeding function. The ovary, maturation and stimulation. In the uterus, monthly preparation for pregnancy or the menstrual cycle. If you are a boy, you will observe that your Adam's apple gets bigger. Your voice becomes deeper and may crack or break. Your muscles become bigger and stronger, and your shoulders become wider. Your pubic, underarm, and facial hair also start to appear. But these changes are actually normal. These are the changes that happens during puberty. During puberty, girls will experience their first menstrual cycle or monthly period. This first menstrual flow is called menarche. Changes during puberty. During puberty, boys may experience wet dreams or emission of sperm cells while sleeping. The first emission of sperm cells is called spermarche. But this experiences or changes are actually normal. Growth spurts. Growth spurts refer to the growth of the body parts at different rates. Boys and girls experience growth spurts during puberty, where their legs, feet, and arms grow faster than the rest of the body. In time, the rest of the body catches up. So what are the changes among boys and girls during puberty? For the boys, deep voice, broader shoulders, and facial hair. For the girls, wider hips, larger breasts, menstrual flow. Underarm hair and pubic hair happens for both boys and girls. How to take care of the reproductive system? Wash genitals daily with soap and water. Change underwear daily. Make sure your underwear is clean. If you feel anything in your genitals, ask your parents to help you consult a doctor. Be careful when using public toilets. Check if the seat is dirty or wipe them before sitting down. Using dirty public toilets may cause serious infection. Or in some way, you can just avoid public toilets. Use your toilets at home. Home is where you can trust the toilets. Okay? That's all for today, and see you in our next virtual learning experience.